start the meeting with our conventional FOSWL prayer. Over to Narayana, please go ahead.
Heaven of freedom, where the mind is without fear and the head is held high, where the knowledge is free, where the world has not been broken up into fragments by narrow domestic walls, where the words come out from the depth of truth, where tireless streaming stretches its arm towards perfection, where the clear stream of reason has not lost its way into the dreary deserts of dead habit, where the mind is led forward by thee into ever-widening thought and action into the heaven of freedom. My Father, let my country awake.
Friends on same wavelength, Chennai Annanagar chapter, our 162nd meet today. That is, we have completed 13 years, 6 months without a break, except for 3 months for the COVID. Today we are meeting, Zoom meeting. I take the opportunity of welcoming all our fellow FOSWLians, in particular ICC Cupertino, ICC Chennai Adayar, ICC Hyderabad, ICC Vijayawada, and members of the Super Senior Citizens Group, as well as Vavilalia Union Groups, and some of the new members who have joined today our meeting. Welcome you all. It's a great pleasure on my part to welcome our special invitee speaker, Mr Naga Ravi Shankar. He is so busy in his schedule, Ravi Shankar. I repeat again, Sri Naga Ravi Shankar is our speaker. He's a busy schedule, but still he could spare some time to talk to us. He's a qualified MBA as well as BTech and AVP for provider in India. He has very good experience in working in various companies in different capacities. And today he is going to give a lecture on the latest technology, artificial intelligence. The subject is artificial intelligence in application to modern medicine, healthcare, modern healthcare. Artificial intelligence applying for the modern healthcare. Very interesting topic. Let us all listen to him, and then he is ready for a discussion to clear all our doubts. Now, before proceeding to it, it is our duty, pleasure to introduce the speaker in detail to all our members, in spite of having circulated it in our mail as well as WhatsApp. It's a pleasure for us to introduce to him. Here again, I would like to welcome one of our own member, Mr. Raghupati of Dignity Foundation. He is a regular member of ours. He could not attend for some personal reasons. Now he has come. I welcome him. I invited him and entrusted to him to introduce our distinguished speaker. Over to Raghupati, please.
Thank you, sir. With great pleasure. It is a great pleasure for me to introduce. And dear friends, this is the second meeting of our artificial intelligence in such a short time gap of after 159th meeting when Dr. M.V.K. Sharma addressed us on artificial intelligence in life and business on 22/3/24. This shows the rapid development of our artificial intelligence and necessary to update. Hardly any day passes today without news of artificial intelligence and penetration. We have with us today Dr. M. Naga Ravi Shankar, BTech MBA, Assistant Vice President, Provident Fund, who is an engineering leader in technology and business for the past 27 years. He has passion for Advaita, Vedanta, Sanskrit literature and Telugu literature too, and his profile speaks that. Profile photo. His passion now is to build, launch and educate the use of artificial intelligence products in production management. He used extensively IBM, ZOS, Microsoft Windows, Microsoft Office. He is going to talk on artificial intelligence use in healthcare, human brain's hand, and brain's hard disk may have super storage capacity, but it tends to forget and at times fade by moods, thoughts, distractions, and tiredness. AI, artificial intelligence, steps in to overcome these shortcomings. Now, I'm over to our Sri N.R. Shankar. Thank you.
Thank you, Mr. Raghupati. Now I call upon our distinguished speaker to give his lecture to all our members, eagerly waiting for his talk on artificial intelligence in modernizing healthcare. Over to Dr. Ravi Shankar, please. Go ahead. Mic is yours.
Thank you so much. Can everybody hear me?
Sure, very well, very well.
Thank you for the introduction. Very generous introduction. Thank you. Just to add, actually, I am in the area of technology for the last 27 years. I've played many roles in engineering and, applied research in other areas. So I felt, I can, and I've been with healthcare provider side of the healthcare for the past 3.5 years at Providence, India. I'll talk about how AI technology is used in the context of healthcare, and speak about some of the use cases that are pretty prevalent in this space. So broadly, there are, if you look at healthcare, there are providers like the hospitals, clinics. There are payers like the insurance companies and the patients. Right? There are three entities in action in healthcare. My talk will primarily focus on the clinical care side, which is the healthcare provider side of the world. And I'm going to categorize my talk in like three areas, broad areas. Now, how do we use technology in the area of patient, facing the patient, right, in the care side of the world? The other one is on the healthcare workers, we call caregivers. And then we look at analytics that is used in terms of measuring the business performance and also the staff in the healthcare organization. So let's move forward with each of these areas. In the patient-facing area, the key technology scenarios are laid out here. I'll talk a little bit on each of them. On the online portals, if you are a healthcare organization, if let's say you are a hospital or a clinic, you have an opportunity to reach out to the patients through your online portals. You provide information on the services that you provide, appointments, medical services. All of them are done online, and we all have used one way or the other the same services. The other place where technology is used is the medical records management, history and reports. You can have access them on your mobile apps or online portals as provided by the provider. So there are technology that are used there. We go to Google or Bing and search for the hospitals or the clinics that are nearby. The patients can look at what are the services that are offered there. There are search services available, so your hospital is listed over there, and technology is being used to find out who has reached out to looking for your hospital or a clinic. Emails come to you. You look at diseases, epidemics, pandemics. We have all experienced during COVID that there's a lot of awareness campaigns being done by individual entities or government or ICMR or other organizations. So awareness campaigns can also be launched and technology is used there. I'll talk about how artificial intelligence enables this, but I'm broadly categorizing the technology use in healthcare. Care and follow-ups, telemedicine, online medicine, mobile centric medicine has been used. So how do you provide care and follow-ups through those channels? Patient outcomes is an interesting area that is evolving in value-based care. Population health is an area that is being extensively studied and employed. We'll talk about population health a little later. We all know about our mobile apps, our health apps, the Apple iWatch, or all our trackers that also provide specific health related information to us. Hospital wards and surgery rooms, I cannot emphasize more how technology gets used there. things are evolving. Robots are being used across the world in specific scenarios. Robotic surgeries are being done. Medical equipment are getting modernized with a lot of automation in them. Hospital and clinic premise management. If any of us have been to hospitals, we would know the amount of technology being used in large hospital settings, starting from the parking where you park your car or a vehicle and then move into physical security, be it how the HVAC systems or the electrical systems, the air conditioning systems are all auto controlled, sanitations are provided, the pharmacies are equipped, the labs are automated, the kiosks help in guiding you to the right places. The concierge and billing desks help you with specific information you're looking for. The wards and surgery rooms, food and nutrition charts have been prepared automatically based on your health situation, and all the transportation that happens between the various buildings within the hospitals if they are large and things like that. So technology in patient-facing scenarios is extensively being used. In the healthcare workers facing scenarios now, there was a myth when I came before into health before I joined healthcare, that doctors and engineers are two categories of individuals. Engineers probably use a lot of technology, doctors probably not. But honestly, I think the doctors are the most technically equipped people and technically knowledgeable people, in my opinion. And that's just my personal opinion, and I've seen this in operation in hospital settings, so I can authentically say that that's the case. So the amount of technology consumption that happens for healthcare workers, be it nurses, doctors, janitors, all of the people that are in the hospital working for us, is humongous. And it amazes me how they can manage the technology use with the patient care, the work that they do on the in curing the patients, right? EMR, EHR are the core of hospital systems. They track your medical records, the health records. Organizations like Cerner, Epic, and others in the US, and there are multiple tools in India, including Zohos of the world, are extensively working in this space to secure the electronic medical records. A whole set of administrative tools, and this is an area of specialization for me in my organization. How do I reduce the administrative burden of the healthcare workers, caregivers, right? Because there are so many dashboards you need to work with, the monitoring systems, ticketing systems, HR information systems, worker health monitoring systems. For example, we all experienced in COVID, there are extensive regulations around the health of the healthcare caregivers, where you're looking at their vaccination status, they're monitoring their health, making sure that they are fit enough to serve the other patients coming in. All of them are tracked through regulatory compliance. Onboarding of a healthcare caregiver is much different from onboarding any other employee in a tech organization. It requires extensive understanding of they're making sure they have the right certificate of insurances, they have extensive trainings that are in place, so that they understand the hospital, the technology, the area they're working in, and become productive on day one to be able to serve the patients. Hospital automation, the operations automation, there are n number of standard operating procedures that are in place for nurses, for doctors to follow every day. They're all extensively cataloged and kept in availability to them. There's an opportunity to automate all of them, and a lot of work is going on today to automate those. The policies around patient care, as well as the internal policies around HR and others, are all automated. Scheduling and staffing, if you've been a doctor or a surgeon, you understand, or you led teams within a hospital setup, you would understand how critical this area is. There are a lot of predictive tools that have come in this space, where you are looking at scheduling scenarios, right? There is seasonality in how patients come to your hospitals. There is also seasonality with respect to change of climate, change of weather. the flow of people into the hospital and out of hospital is changed. Your staffing needs change. The type of expertise and skilling you need are changing dynamically. So this is an area of extensive investment in technology in healthcare side. Regulatory compliance, ethics play a major role. I talked about certificates of insurance. Ethics is a huge area in healthcare. You cannot share patient information. Even within doctors, they cannot share each other patients' information just like that. They need consents. They need a lot of monitoring around patient information. PHI data has to be protected, and all the around regulatory compliance around that. Emergencies are part and parcel of hospital setup. There needs to be a lot of alerting between nursing station, wards, and the the surgical rooms. There's a whole communication mechanism, and technology helps in terms of setting up of all of that. And finally, physical and virtual security. Physical security, we all know, getting into a hospital, you need all of that physical security to be in place. What's interesting that has come out post-COVID is that while hospitals were a set of systems that were not, traditionally targeted by hackers or any other malign groups, because they thought that this is an area that we should not be touching. This is related to the people's core lives. But post-COVID, we have observed that there are a number of malicious attempts to bring down hospital infrastructure, especially the technology infrastructure of the hospitals through malware and other scenarios. Primarily because there's so much of there's so much at stake. With the patient data access, there's a lot of work that has happened in terms of generating IP within the hospital technology. There are a lot of security attacks that are happening, including Providence. We are a $28 billion organization. We have about 51 hospitals in the US and 1,000+ clinics, and we have about 500 pharmacies that we operate across multiple states within US. We extensively invest in cyber security, and we have seen extensive number of security threats that have come to our systems in the past 2 to 3 months. Forget the large time frame that we have. Even within the last 3 months, we've gone through a lot of pain through cybersecurity issues. So there's a lot of technology use even in this space. The next set is an interesting area that probably connects to my talk on AI, is analytics. Right? There is a lot of analytics investment happening in healthcare. I've given you a high level use case here. For example, drug usage and care analytics. There is history in large hospitals about a certain prognosis being given to patients of a certain type, and a certain disease symptoms. How do we start learning from it and start looking at effectiveness of drugs on patients and tracking them and see how it's working, right? Care patterns is another area we look at extensively in analytics. ERP, enterprise resource planning. Think of that as an input to our hospitals. All the supply that we get for various either it's drugs that are coming in, or I'm sorry, when I say drugs, it's medicines that are coming in, or the equipment that is coming in. And then we have the EMR or EHR, which is a consumption side, where we are trying to consume what is being brought in. There are stock levels. We have to work with our suppliers. So there's a lot of work that happens in inventory management, stock level management in this space. Population health, I touched upon it earlier. Virtual care, value-based care is a very important area. At Providence, we get about 20 to 25 to 30% of our revenue through this channel. Think of it like a doctor or a hospital is incentivized by government by keeping people healthy, as opposed to curing people when they fall sick, which means that the doctor is given a population of people whom he'll contact, he'll virtually or through tele services, make sure that they're doing well, their lifestyle is good, they are able to understand their health situations, their nutrition is tracked so that they are all doing well. And then when much of the population is healthy, then there's an incentive for the hospital or the doctor, getting paid through that process. So it's a very interesting turnaround. It was a situation that we in India probably saw when in our past, but it is catching up a lot in the West today. And value-based care is a big area of investment in technology. Healthcare worker life cycle, right from hiring to onboarding to retention to benefits usage through exit, all of the life cycle of a healthcare worker is tracked. Various issues with respect to any challenges in the process, in the experience that they go through, are looked at and analyzed extensively. Journey maps are created with respect to their various phases of their career with the hospitals, and then tracked and looked at if we can do anything to improve their life. Here's where the administrative burden is a big area to analyze and look into. Hospitals have flow, which primarily means the number of footfalls, how they stop at the concierge, probably stop at the billing station, stop at the OPDs, stop at the checking into the wards and all of that. There's a whole flow analytics process where we look at how the flow in the hospital is, how we can serve more patients in a more smoother fashion. How can we put the various place the various departments and equipment within the hospital in such a way that there's way more efficiency in the running of the hospital. There's a lot of analytics that happens. My team also looks at this problem more closely, and we kind of analyze and identify hotspots and help the hospital operations team, the CEOs of the hospitals, to get better. I talked about security. I won't go detailed into it. Risk and compliance is a huge area, right? Like be it HIPAA compliance. In India, we have quite a few compliances to meet if you're a hospital in India. Make sure that the payer policies are honored so that we get paid from the payers, the insurance companies. Digital and marketing analytics. Honestly, if we compare retail and financial services and other domains, marketing is a huge area, and marketing has got a lot more ability to go and connect with the customers. Healthcare has a lot of laws governing marketing. We have to be careful. You can't be marketing saying, please come to our hospital, take our services. You cannot be saying such things to the patients. There are so many laws that are carefully written so that it is not made a business. There is a lot of responsibility to healthcare organizations. So our campaigns are primarily awareness oriented, are targeted very specifically to make sure that the marketing is done in an ethical fashion. And return of marketing investment is a huge area of work. I actually lead a marketing analytics team for Providence, and we spend an enormous amount of time in curating our campaigns to help the patients in a specific geography to make sure that they take our services and we are very ethical about how we market our services. And finally, but the most important part for all of us, in this group and across the world, is environment sustainability. Sustainability in hospitals is a huge problem to deal with, right? Hospitals account for a large part of emissions, because of the type of material they use and the kind of care they have to take in terms of dealing with infections and others. So whether it is waste, landfill waste versus recyclable waste, whether it is energy, whether it is agriculture, there's a lot of food intake in the hospitals. We want to make sure that the food is not wasted and specific nutrition regimes are taken care. We bring in food from in a way that it is environmentally sustainable, and whether it is chemicals that are used, be it anesthetics or any other chemicals, can we bring in and use in the pharmacy side of the world, chemicals that are the environmentally sustainable, whether it is transportation, whether it's traveling patients across, can we also use sustainable energy like maybe EVs and others within the hospital premises to reduce the emissions. We in Providence, I'm actually building a huge dashboard and helping Providence become carbon negative by 2030, and which is a huge endeavor in itself. And there's a lot of work happening in hospitals across the world to be sustainable. So I just wanted to bring out the technology scenarios, and maybe you would appreciate how much more of work goes into technology enabling a healthcare system. I will then go into artificial intelligence. I know there's been probably a talk earlier, so I'll not go deep into the into all of the information on artificial intelligence, but I'll give you some scenarios where artificial intelligence is employed in healthcare. Broadly, artificial intelligence is theory and development of computing systems that are capable of performing tasks that traditionally are performed by humans, right? So be it ability of cognition, making decisions, considering multiple factors, data-based decisions, identifying patterns as humans do, and ensuring that they help in making decisions and performing those tasks in an automated fashion. There are four broad areas in artificial intelligence: machine learning, deep learning, autonomous systems, and generative AI, which is a new area that has come in. We use large language models, as we call in generative AI. Now I will talk about each of them in a little bit of depth and cover the healthcare scenarios around those. Machine learning, think of them as algorithms or programs that learn from data and make predictions. They are very evidence-based. For example, in giving personalized recommendations, in a non-healthcare scenario, if you are using, let us say, a Amazon Prime or a Netflix, or if you are using any YouTube or any of these applications, you would see there is a recommendation coming all the time to you in terms of if you have watched a certain type of content, if you have looked at a certain type of information, it will start recommending you personalized information in similar areas. So that is done through machine learning algorithms in the back end. Fraud detection, if you're using your credit card or any of those mechanisms, how do you detect fraud? Whether it's coming from actors who are non-untrusted actors, or a genuine transaction. How would you do that? All of that happens through machine learning in the backend. Now there are sort of four major areas of work in machine learning. I will not go deep into what they do, but I'll give you a little bit of touching upon what each are. Supervised machine learning is a technique where you have labeled data. For example, you can label this data and say this label has this data has a specific context, and use this context in when you're making predictions, right? You can tell the program or algorithm that it is labeled in a certain way and has a specific context. So the machine understands that it has to use the data in that context only, right? So supervised machine learnings are used in places where we need a lot of intervention of expertise and make sure that it doesn't act on its own. So in problems like disease diagnosis, in drug discovery, in clinical decision support, like if you are trying to make some decisions in a clinical process, or writing a prognosis on a patient situation, you can trust supervised machine learning, because they have the program has been trained to use label data, and has been looked at and very closely before that program has been presented to you in that situation that I talked about. Unsupervised machine learning is enabling the program to look at the data and identify patterns on itself, right? There is no prior labeling. Labeling is dynamically created by the program itself. They analyze, create clusters, they find inherent similarities in the data, differences in the data, and patterns within the data. The programs are smart enough to find out that. It is used in areas like, there is, if data is huge with multiple dimensions to it, unsupervised machine learning is used for such problems, right? Clinical data analysis, patient segmentation, a very important area for revenue and targeting within by the hospitals. Patient segmentation is done through unsupervised learning. EHR analysis, as you know, there are n number of attributes to this data when you have EHRs, and also image segmentation and clustering when you have X-rays, MRIs, CT scans. Imagine the amount of data it produces if you have to scan it and make sense of it. So the unsupervised learning is used in such kind of scenarios. Semi-supervised learning is a bridge between unsupervised and supervised, where you are labeling some part of data, but the machine algorithm also knows that there is unlabeled data, and it combines both of them and works through it. For example, if you want to augment clinical data with certain certain type of recommendations, you can do that through the semi-supervised machine learning process. Reinforcement learning, also called RL in the AI world, is a wonderful, fascinating area of machine learning. This is an area that has started getting a lot of importance, where an agent, a machine agent, learns to take suitable actions in an environment, and to maximize the rewards in the process, right? So automated medical diagnosis, drug dosing and administration, clinical trial design, it's a very as the type of endemics and pandemics have started growing significantly, and designing a clinical trial traditionally was a very, very difficult process, right? Reinforcement learning helps you get to that very quickly, and gives you that kind of structure where you can actually make decisions quickly in setting up your clinical trials. Resource allocations, I have seen it personally in our hospitals during COVID. I joined Providence in the peak of COVID, and when we looked at some of the problems the hospitals were looking at, resource allocation is a huge area, because certain hospitals has excess resources, some don't. Treating COVID patients, we needed to move people across hospitals. We were having complex problems like labor union issues, location issues. Certain staff wouldn't move, certain staff would like to move. They have to be dynamically allocated, but then we have to consider multiple factors to do so. So RL algorithms were used to figure out what is the best way to allocate our resources, and then work through that process. So these 4 areas of machine learning and these use cases are helping the hospitals get better at these scenarios, and there's a lot of work going on with the ever increasing amount of data that we are finding in hospitals. The other area is deep learning. Think of it as a layer neural network. I remember I did my first artificial neural networks project in 1997, when I actually was at NIT Warangal trying to work with artificial neural networks at that time. The challenge between at that time was the amount of technology that was available to process these really deep computer science problems. There were limited hardware that was available. Now with NVIDIA GPUs and others coming in, and cloud net computing coming in, this area has exploded significantly, right? Image recognition, for example, we all know, if you're a doctor, you would know the number of X-rays, MRIs, CTs, and the number of data points that they provide. Recognizing those images, being able to analyze the images is an area of deep learning that's very popular today. There are a number of apps that have come in, number of organized companies that have started coming into this area. NLP, speech recognition, we all know, while the patient information is collected, can we, do the data entry on its own without, us entering it. Voice assistant, excuse me, can early disease detection, making sure that you look at the tests and ensure that you can detect those possible issues with the patient. Natural language processing, this is precision medicine, specifically personalized treatment. As there is in telemedicine, it is extensively used. NLPs help you to decipher what the patient is saying and trying to put together, certain prognosis for them. Sentiment analysis is another area that is extensively using NLP. Recommendation systems, primarily around food, drugs, and physical activity, healthcare provider recommendations. This is extensively used in your, watches, trackers. They help you, they track your data for some time and give you some recommendations. If you see, it will tell you you're probably cardiac, your cardiac activity tells me that you are not fit cardiac wise. You can do certain things to help yourself. All of these recommendations are done through deep learning recommendation systems. Autonomous systems are machines that allow machines to perform tasks independently without need of human intervention. Self-driving cars, medicine delivery robots that are available today. Driverless wheelchairs. Imagine that scenario where hospitals can have wheelchairs that can take a patient from surgical room to the ward, or from ward to their car without needing any assistance. Smart carts, to help find out the right set of once you put your medicines in your carts, it will automatically give you a bill, and then you can pay it, and without really going into a lot of hand holding. See the efficiency it can bring in hospitals once these technologies become quite prevalent. Telemedicine is a huge area for autonomous systems, surgical assistants, rehabilitation robots, sanitation robots, helping sanitize areas without any human assistance. Prescription dispensary. Scientific research is where there's a lot of work happening here, right? Having drones, small drones within hospitals, telepresence robots, drug discovery, and laboratory automations. So those are like big areas that autonomous systems are used. Sample preparations, for example, and high throughput screening is an area of work that's happening. Generative AI. Now, this is a huge buzz in the system with Chat GPT, with Bard, with Copilot from Microsoft. You have seen generative AI take a huge buzz in the industry, and it is actually a game changer in my mind. I was attending a Gartner conference last December, where the entire conference was about generative AI, as a matter of fact, where how do we leverage this new AI models to be able to help improve the productivity and efficiency within hospitals, right? So we in Providence are also extensively using generative AI, and all within a period of last, I would say, 8 months to 1 year time frame, because what this did is this technology actually brought in AI to the use of a common person. You don't need extensive technology understanding. You don't need to work with deep algorithms. As I said, when I was doing my college and I was doing operating systems at IBM, the machine level languages that we were using, and what I have worked for 5 to 6 years working on AI and deep computer technologies, is now brought out to a common person through the generative AI technology. I always used to joke with my team that the first 17 years of my career has been washed away by cloud computing, and now generative AI is an area that will take another leap into how computing is done. So in this space, automated clinical documentation, patient interactions, clinical notes, being able to machine listening into the conversation and preparing notes automatically, streamlining administrative work. If you say, hey, I want to follow up with a certain patient, can you please arrange that? And can you take care of these 3 set of activities? If a surgeon or a doctor says that, generative AI looks at it, creates follow-up tasks in the calendar, goes and starts creating tasks within those systems to be able to, instead of a nurse going there, setting up all of them through the administrative process, right? So it's that efficient. So there's a lot of work happening in this space. Drug delivery, genomics is a big area of research in drug. It also, if you go into molecular structure analysis, the amount of data you're dealing with is huge. These large language models deal with billions, if not trillions, of attributes. So they have extremely high computing power, and they can do this analysis in a very, very reasonable time. Earlier it used to be 20 years, 25 years before we found patterns, but now it's in a matter of under few months. And that is where the COVID vaccines have come in. They have used this extensively, this technology, to figure out the structural aspects of molecular structural aspects of COVID, and be able to create the vaccines quickly as part of discovering the drugs for it. Pharma and treatment approaches innovations are happening. Chatbots and virtual agents. We have something called Providence Chat in our company, where we can go and ask any question to that chatbot around some of the internal information of Providence, and be able to be getting good answers from them, not indicative answers, but summarized answers from them, right? And healthcare operations, I can't tell you how much healthcare operations will be benefited by this technology, be it filling forms, data entry. There's a lot of duplication of work. All of that, generative AI would be able to do it. Summarizing calls, generating notes. I use it all the time in my Teams calls. When I go to Microsoft Teams and use Copilot and switched on, whenever the call happens and completes, it gives you a crisp summary of the call, the follow-ups, the the action items, all in a quick summary, and that I can paste into an email and send out. So these are some of the big uses of generative AI. With this, I conclude my presentation. I know I've been talking ad nauseum. I'll probably take some questions if you have. And this is what I wanted to present today. Thank you for the opportunity.